Listeners, in our today's program, we have the second part of Music in the Cells Matrix Therapy, an interview with Dr. U.G. Randall and Dr. Harish Kumar. Dr. U.G. Randall is the inventor of matrix therapy in the field of physiotherapy. This interview is taken by Dr. Sandeep Bhagwat.
We have the inventor Dr. Randall with us. Let us understand from him. He has done a lot of research in cell biology,
Yes,
and it is really very impressive to see the ulcers healing with this equipment. Doctor, can you please elaborate on how does this happen? How does the ulcer heal? In one point you say it treats the back pain, neck pain, and in the other, Dr. Harish has treated some ulcers. Can you explain how this happens?
Well, I will. I appreciate to explain it. It's very simple at the end, because we have first to understand what is a symptom or what is a disease. Normally, we see all these symptoms very abstract. When we say basically that life is a process, then it must be clear that every disease, every symptom must be a derailment somehow of a process. And normally, when you just have crutched your finger or you have a little blesses here and there, it heals by itself,
Yeah, the healing is within the body.
This is the healing in the body. This is a very simple saying.
Yeah.
But then, of course, suddenly we say, now we need a doctor to treat.
Yes.
What is now with the self-healing?
Yes.
And so we have two systems. One side is the doctor comes and has to do the healing, and on the other side we say, no, it is the self-healing.
Oh.
And now we have to learn that it's always the self-healing, always.
Yes.
And the doctor or the physiotherapist or who else is coming from outside is only the conditioner of the environment of the cell.
Okay.
Yes, that is like a farmer, You cannot plant anything when in the desert. You have first to prepare the ground. That means you have to put the water inside, you have to come with a scarifying rake, open the ground a little bit, prepare everything, and then you put the seeds inside. And in our case, the seeds of the body are already there. So you only have, like the farmer, just to prepare the ground, to put the water inside, the seed inside, and then you start praying. Oh. Yes? And then the self-healing takes place in the conditions you have prepared. And what kind of conditions do you have to prepare? Just the evolutionary principles and evolutionary environment. Yes? And this is, I will give you maybe for those who have not got the idea, I will compare the body like an orchestra, And the cells in your body are playing together more or less like the musicians in the orchestra. And so at the end, when they are playing the right music, then you get a wonderful symphony.
Yes.
But now you have musicians that don't get enough breakfast or lunch or dinner, so they get weak,
Oh.
And what happens? They even cannot hold the trumpet or the violin or the instrument in the hand.
Yes.
So the instrument falls down, and now you get an orchestra that plays only here a little bit, there a little bit, and this is just a sick body now.
The disturbed rhythm.
A disturbed rhythm, and they don't see the conductor anymore, and they try to do anything. But at the end, what they want to do is they want to play the music, but they don't have the capability anymore because they are too weak. And at the end, they're just sitting in the orchestra and don't see anything, and they have to die, but not enough to live,
Oh.
So they are just a little bit in between. The cells are in the standby.
Oh.
And this is now the case in many bodies, where it is aching, where you have stiff bodies, a stiff spine, the ankles don't move anymore, everything is rigid. And in such cases, we come with our Matrix Mobile and we open the muscles, the skeletal muscle, bring back the elasticity to these tissues, the metabolism is activated, and by a sudden, from the micro movements, we go to the macro movements, and from the passive side to the active side. And so, like a crank ankle, you just activate the whole orchestra and bring it back to the normal.
Oh, now I understand that the muscle or the myology is at the center of your process-oriented medicine, biomedicine.
Yes. So it is funny, we have for each organ, we have a specialist for the bones, for the liver, for the nose, for the ears,
Yes.
but not for the muscle. Even the skeletal muscle is our hugest organ.
Yes.
And the skeletal muscle is our driving organ. That means for the micro processes and for the macro movement.
The processor of the body.
It is the process responsible for all the processes. And then when you are anxious and when you are really trembling, and shivering, then you have synchronizing in the range of 8 to 12 hertz. That means 8 to 12 beats in 1 second.
Yes.
And this is a frequency range in all warm-blooded animals, in horses, in cows, in human beings, everywhere.
Yes.
And this is the synchronizing frequency we need to get an optimum of microcirculation. And this is why we use exactly this frequency range for everybody.
Oh, the window of 8 to 12 hertz.
Exactly. And because it's a physiological window, we can never harm. That means in a healthy body, when we apply it, then of course the system tells us, well, I know this frequency range, I feel it as a good feeling, but I have not an effect. But when it is sticky areas, blocked areas, as Dr. Harish has told us, then we just activate the tissue, and then we just from the grapes, from the raisins, we get grapes again, and this is just bringing back the elasticity, and the whole system is starting to play back like the orchestra before. So it's a kind of anti-aging. And when I focused on anti-aging, think about the wrinkles, think about cellulite. This is the same that you see from outside, that the tissue has no circulation, and then you get all these ugly cellulite areas, people don't like it, and also the wrinkles. It's a question of blockages of the muscles, and when you get the release by activating the circulation and the metabolism, then of course you get a very soft and elastic tissue back.
Oh, that's very good. So you can use it for wellness, as you mean to say then?
Also,
yes.
So this is a general method now for prevention, care, cure, and getting better from performance, and of course wellness. You are always treating the principle of physiology, and I don't care about the symptom, but I personally use it preventively, so I prevent the stop of process. So when the processes are running, I can never get a pain because the pH in the tissues remains constantly, and the sympathovagal balance of the system stays. And so especially people that are suffering from stress, for example, what are they doing reflectorily? They are contracting the muscle. And at the end of the day, when they are sitting on the chair 8 hours, 10 hours, everything is hard, and they have stress. And some of them go to the gym, but then they severe the problem.
Yes.
What they need is a kind of massage technique,
Oh.
but this is not in our mind. We go to activity,
Yes.
but you need passivity.
More of a contraction.
Exactly.
So the relaxation is primary.
The relaxation is necessary for the next action.
So they can do it for wellness as well.
Yes, and it's also a very nice preparation for yoga. People are doing yoga, but yoga is a macroscopic stretching of a muscle.
Yes.
And just reflect now, when you compare a muscle, a skeletal muscle, to a rubber band, when you stretch a rubber band, where does it rupture? Is at the weakest point.
Yes.
And so I'm not a friend of yoga if the muscle is not prepared to be stretched.
Oh.
So you have to make first the muscle elastic,
Yes.
and then you can do the asanas, and you can just go to the range of
Get
motion.
the maximum benefit of the
Yes.
yogasanas.
Yes.
So you mean to say the yoga practitioners also can use it for preparation of for asanas to
It's
go
for-
to the next level of
Yes.
practice.
Yes, so I can tell you examples. In Munich, I have my clinic, and I have many people practicing yoga. So but they don't prepare their bodies that yoga can be done. Even the teachers in yoga, practicing yoga 10 years, are suffering from pain.
Yes.
And then I say yes, because you don't get enough massage to soften your muscle,
Yeah.
and now you have tendinitis and all these calcification of the tendons. And of course now you should first prepare it with matrix rhythm therapy, and then of course you can continue with your asanas as long as you want. So to keep the system flexible, then asanas are perfect.
Yes.
But before, it has to be prepared on the micro areas that you can do it without pain.
So first micro exercise and then macro exercise.
Exactly.
So this can be useful for sleep disorders as well,
Yes.
because you said the sympathetic and the parasympathetic imbalance, and that causes a disturbed rhythm.
Exactly. So the best examples are there when you have CP children, cerebral spastic children, and
It's useful for the children too.
Yes, I just want to give the example on these children, because they cannot sleep, they have bowel problems, they have stress from the first second when they are on earth, when they open the eyes, from the birth trauma.
Oh.
And all these traumas are, they carry day and night in the body. That means a small signal, you switch on the light and this gives a stress, and the child is contracting. And contracting means also
They're
for
afraid of,
and for the intestine it is like a shock,
contracted.
And so they have bowel problems, they go to toilet maybe once a week, and when you de-stress them from the paravertebral spine, then you get a release, and the parents are so happy, and they tell us that first time in the life the children sleep more than 6 hours, 7 hours, bowel problem has gone, digestion has started, because they have learned what the state of relaxation means. They never felt relaxation because of this stress trauma directly during birth.
Yes. Harish, what is your experience about these conditions?
Yes, we have treated the insomnia cases as the sleep disturbance, anxiety patients and all. So they complain that we are not able to sleep. They use mobile phones in the night time to get the sleep, or they see TV or movies to
the
get
stimulation of the brain and hence they can't calm down.
Yes. So in those cases, when we give matrix, as I said, on the spine segment, paraspinal segment, the sympathetic and parasympathetic get balanced, and that gives a magical difference in the patients. Same way for the CP child also, like CP child and autism child, where the child is on a higher frequency level, will be having a magical result in it.
Calm down.
They will immediately calm down. Recently we have treated a patient where the child is not able to sleep. When we start the treatment also, the baby is not able to control it. But after 10-15 minutes, 20 minutes time, the baby started to sleep. It started to enjoy the session, enjoy the matrix vibration. That frequency level is more comfortable for the child.
Yes, thank you, Dr. Harish, for being with us this evening today. It was really very nice to have you in the discussion with Dr. Randall.
It's my pleasure to address with the researcher, the man behind matrix concept, and share my experiences, share my success stories with you. So it is my honor to be with this dais. Thank you.
Dr. Randall has a non-profit institute in Germany, and he regularly conducts programs. He also has plans to start this work in India also. It's really appreciable, sir. Thank you very much for all the insights that you have given us, and we have a new understanding of the concept, the matrix concept, the cell, the oscillations, myology, the process-oriented biomedicine, the muscles as processors of our body. It was really wonderful listening to you, sir, this evening. I thank you for being with us. Thank you so much.
Thank you so much for giving the chance to spread the concept. Thank you.